This is In the Loop. I'm Christian Bryant. We're starting off today discussing what many in the medical community are calling a breakthrough in treating obesity. A drug named Wegovy got FDA approval for obesity treatment in individuals above the age of 12 last December. While Wegovy has been showing promising results, another drug under consideration for approval to treat weight loss could work even better. But before we dive into those details, let's first talk a bit about obesity.
The medical community defines obesity as having a body mass index, and that's your height to weight ratio calculated, over 30.
That's Dr. Michelle Guy, the director of the American Board of Obesity Medicine. She told us that obesity, which already affects more than 41% of Americans, has been on the uptick in recent years.
We are becoming a more obesogenic society. We have more access to calorie-dense foods, as well as sometimes our infrastructure doesn't support having more access to commuting, walking, having a more healthy lifestyle outdoors.
Dr. Judith Corner, the founder and director of the Weight Control Center at Columbia University, also spoke with Scripps News about obesity, diving into deeper issues that can lead to people gaining weight.
It's probably somewhere between 50 to 80% genetic. Of course, there are other factors. There are environmental issues, socioeconomic issues, life issues, psychological issues. It's really very complex.
Doctors Guy and Corner told us how Wegovy was originally created to treat diabetes and sold in a slightly different formula as Ozempic, an anti-diabetic medication similar to Wegovy, before it was popularized as a treatment for obesity. There's been a shortage of Ozempic because of a heightened demand for ways to lose weight, but those who are able to get their hands on Wegovy, again, similar drug, are seeing big results with few risks.
In the past, when we compare it to other medicines, say such as Contrave or Quisimia, which have been other medicines that we've had around for weight loss, on average, those are about 7% weight loss. And so the 15% weight loss with Wegovy as a medication for weight loss is really coming close to what we see with bariatric surgery.
Now, another drug under fast-track consideration by the FDA for weight loss treatment, Mounjaro, also called tirzepatide, has been showing up to 22% weight loss in clinical trials, more than triple what older drugs for obesity promised. For patients, that could mean an even more effective way of losing weight without invasive surgeries.
This has been a very exciting time for healthcare practitioners who are trying to treat obesity.
Mounjaro's producer, the Eli Lilly company, has boosted production of the drug in anticipation of big demand and to bypass any potential supply issues. These new medicines also promise fewer side effects than their predecessors. But behind the breakthrough treatments for obesity are the complex issues of self-love, body positivity, and how we as a society view and treat individuals with obesity.
Social psychology research suggests that weight and fatness stigma are among the most powerful and prejudiced of the social stigmas.
Lisa Legault, a psychologist and associate professor at Clarkson University, spoke with Scripps News about the psychology behind the body positivity movement and where it began.
So it sort of started with this effort in the 60s, 70s, 80s among Black women living in marginalized bodies to question these narrow standards of beauty.
While Black women led the charge against largely Eurocentric standards of beauty and body image by general society, things like thinner noses and lips, fairer skin, bigger eyes, the body positivity movement today has expanded even further. And one of the issues it addresses is stigma within the medical community, which even doctors admit is a problem.
Weight bias and stigma has been very prevalent, starting with the media and society. And of course, then that trickles down to, individuals and humans, including physicians and medical providers.
Many body positivity advocates claim the medical community shrugs off health issues facing individuals with obesity, associating them all with weight, and claiming weight loss as the only solution. These advocates also call for a re-examination of the importance many medical experts place on body mass index, or BMI. Experts like Drs. Guy and Corner agree it's an incomplete metric meant to be used just as a starting guideline. It's not necessarily an indicator of overall health.
someone can have a higher BMI, but if they're very athletic, a lot of that may be muscle, and we're not really talking about excess fat. That's where you would have to do more sophisticated considerations of, body composition.
While doctors are supposed to consider the bigger picture of someone's health before prescribing anti-obesity drugs, some practitioners have also been prescribing these medications to people who don't have obesity and just want to lose weight. Confessions from celebrities like actress Chelsea Handler or tech CEO Elon Musk about their use of Wegovy has also shined a spotlight on this issue. Experts we spoke to warn that these drugs are long-term medications and the risks of intermittent use are not clear.
We haven't studied this. We haven't studied any weight loss treatments outside of a really kind of regimented lifestyle interventions with medical supervision. There's always risks for misdosing, especially with the higher doses. You have risk for nausea, vomiting, diarrhea, constipation, which then can be lead to other medical problems.
At the heart of this entire issue lies a conflict between aggressive theories of body positivity and society's historical preference for thinness, which can understandably create a lot of confusion for people considering treatment for obesity. Each camp can dig into their own views hard, with medical providers and individuals who prefer thinness too much on one end, and body positivity advocates who insist on self-love above all else on the other. Legault's research into popular body positive messaging explores the complexity behind this issue.
Just like it can be toxic to expect people to be happy all of the time rather than sad, this is actually, it turns out, not good for overall wellness. It can also feel very stifling or pressuring to always feel like we should be satisfied with our bodies, and that if we're not, we're somehow failing. If we express any degree of dissatisfaction or disappointment, then we're failing to live up to this positivity standard.
Experts like Legault say feeling positive about your body and weight needs to be an internal process, not something done out of obligation. But establishing a healthy self-image and self-love can be tricky, especially when you're younger. The American Academy of Pediatricians recently released new guidelines to treat childhood obesity. But many eating disorder specialists and body positivity advocates oppose the new guidance's focus on use of weight loss drugs and BMI. They say the guidelines will exacerbate weight stigma and can lead to body image issues among kids. National correspondent Meg Hilling tells us more.
It's the health guidance that has many folks doing a double take.
I was like, wait, is this for real?
In January, the American Academy of Pediatrics released new guidance on how to evaluate and address childhood obesity, sparking outrage among eating disorder specialists across the country.
I am horrified, alarmed, and concerned.
The reason? Many eating disorder specialists say they're worried the guidance will lead to a rise in eating disorders among children and adolescents.
So first of all, I think that these guidelines need to just be completely thrown out.
In particular, specialists are taking issue with intervention measures outlined in the guidance that include weight loss medication and bariatric surgery for patients as young as 12 and 13 years old based on their BMI.
I think that this idea of, surgically changing, still a child's body or giving them weight loss medication has been very concerning to the eating disorder community, not from just an immediate consequence of what that could do to a child's body when it's still developing and growing and going through puberty, but also in the future, what that means for that person's relationship with food and with their body and what it's really communicating to them.
For many specialists, these concerns stem from encounters they've had with patients.
We know that for adults, following a post-bariatric regimen is difficult. I think that compliance among kids is just going to be a nightmare.
I have had some clients that have been put on diets at very, very young ages, and then they come to my office 10, 15 years later because they were put on weight loss at the age of 12, or they went to some clinic at a local hospital where they were told that carbs were bad.
Prompting experts to call for an overhaul of how weight concerns are discussed.
I think there needs to be a whole lot more talk about how do we help kids understand that they're not a disease because of the way their body looks.
As for BMI measurements,
I think we do more harm than good when we take one data point and say, based on the fact that your BMI is, 28 or 30, you have a disease.
By pushing people to get into this normal weight range, we're only causing eating disorder behaviors.
To replace it,
We want the community to look at this more holistically.
with mental health taking a more central role when it comes to diagnosing and treating concerns.
Unless health is considered more broadly and inclusive of mental health and inclusive of size diversity, we're going to continue to see worse health outcomes. And none of us wants that.
When it comes to pediatrician visits, many specialists recommend keeping weight conversations just between the parent and physician.
I think it's incredibly important that you do not let a physician talk to your child about their weight, like full stop.
I've told parents, write a note, give it to the nurse, give it to the doctor right before, say, I don't want to talk about my child's weight. If that's something you want to talk about, we can, find a different time, whether it's over the phone or, the kid can be in the waiting room or whatever. So I think it's not only advocating in those moments with your team, but also seeking other consultation as well.
Eating disorders aren't always the easiest to detect. So specialists say it's important to be
keeping an eye on how do they feel about their body changing. If kids are not eating with the family and wanting to eat in their room, that can be an indicator. If you're noticing any weight changes, that could be something to kind of look for, and it can be in either direction.
And if you are concerned that your child has an eating disorder,
but I generally tell people, as a parent or as a loved one, to use as simple language as possible. I've seen this behavior or change. It makes me think whatever the parent is thinking. It makes me worry that you're depressed or maybe are struggling with food or are struggling with an eating disorder. And I'm concerned.
Meg Hilling, Scripps News, Chicago.